Well, ctDNA is circulating tumor DNA, and it's like it sounds. It's little bits of DNA from the tumor cells that is circulating in our plasma or blood. And one of the things that we think will be a really nice biomarker assay to help our patients is to identify patients with levels of ctDNA so we can look at things like monitoring residual disease and identifying other features that might help with regards to classifying and treating these patients. I think one of the things we wanted to look at was how could molecular progression, the identification of cell-free tumor circulating DNA, the changes, how could we use this information to provide more than just standard radiographic imaging by RECIST, right?
So with our technology, you're able to detect earlier than ever before whether or not the patient is at risk of relapse, whether or not that cancer is going to be coming back.
So with respect to molecular progression, using this tumor-informed assay, on average, we were picking up progression 2 months prior to imaging. This is a major advance because now we can start treating the patients sooner or have a better idea how the patients are doing and thinking about monitoring their therapy. This is a very important finding.
So for patients who have a positive result, they are likely to recur. And in fact, we see that in some data sets, all patients who recur had CTA detected in advance, and lead times varied. They could be very wide depending on the cancer types.
The core of this technology is the advance in identifying patient progression, right? And molecular progression compared to radiographic progression by RECIST. And I think that the month, 2 months, and some patients even more, that allows a therapeutic window for us to intervene in these patients that may be responding at a very early time, perhaps providing a better therapeutic window, better therapy options, and better responses for our patients. And I think this is one of the main advantages of this technology.
And we're going to see more clinicians ordering and more patients benefiting from getting access to the information that they need and their care team needs to really plan ahead and understand what's coming next.